Well, for many women, it is a life changer. Breast augmentation is becoming increasingly popular, and with the latest technology and advancements, the number of procedures done continues to climb. This morning, we have a guest, Erin Stevens, with us that is going to share her story. She is also joined by Dr. Bahardi, a plastic surgeon and the one that performed the surgery, and it's great to have both of you with us today.
Thank you for having us.
Well, Erin, let's start with you. Tell me a little bit. I know you had the procedure done about a year and a half ago, I guess?
That's correct.
Tell me a little bit about what led you to want to have that done.
Well, all my life I had small breasts. Had always just compensated with a padded bra to make my clothes fit correctly, and just had always been very self-conscious about the fact that I didn't feel that I was proportional. So one morning I was standing in the mirror and I complained about my small breasts to my husband, and he said, well, why don't you do something about it? And I said, well, okay. And so we decided to take that step and contacted Dr. Bahardi to see what our options were and move forward with possible breast augmentation.
And Dr. Bahardi, I know when you spoke with her, you met with her a couple of times before the surgery, and I know that communication, you said, is so important before a procedure.
Right, it is important because there's a lot of things that have to be talked about. A lot of patients aren't sure what type of breast implant they want, what incision they're going to choose, or what size they're going to be. So it takes time for them to understand kind of what the options are, and it takes time for me to really understand where a patient wants to be. A lot of times patients may say, well, I want to look very natural, and then they say, and I ask them, what about when you're wearing like a bikini? And then they describe that they want to wear no padding in their bikini and have a rounded breast. Well, that's very different from being natural. That's an augmented appearance. So it takes at least 1 or 2 visits to get to that point to figure out what people want. And that's what we did with Erin, and she was from a little bit further away, and so we actually had a phone consultation before, and then she had her visit that we planned her surgery, and then we had her come a little bit early before her surgery to make sure everything was answered before we did it. So I really like to spend a lot of time with patients just to make sure you don't have to do something again later on if the size isn't what they want.
That communication is so important.
Absolutely, and that's what I would say is that there was never a time where there wasn't constant communication of, now tell me exactly what you want and what your expectation is. How do you want to look in regular clothes? How do you want to look in a bikini? And then going through even the differences in the implants. I had no idea that there were different implants and what the options really were or where the incision points were. And so to know exactly step by step what the process was going to be, and this is how we're going to do things, and this is what you should expect, and to go through that process and know in detail, and then that process be exactly as it was explained is amazing.
And what was it like for you following the procedure? How has it changed your life?
Well, honestly, to be able to take your top off and just be like, yay, they look normal and they look natural was huge for me. So to be able to wear normal clothes and not have to have the tops taken in or taken up was wonderful to me, to where I can wear a bathing suit and I don't have to have triple padding and feel like, you get out of the pool and you drip water for 45 minutes because your top is just so full of water. So those are the kind of things that are just so fantastic that, I stand straighter and I talk to people more because I'm not self-conscious anymore of, is someone looking at me and thinking, oh, she's just not proportional.
Mm-hmm. And Dr. Bahardi, I know you hear that a lot from patients. It's amazing what it does for their self-esteem and personally and even professionally, and it just sort of completes us.
Right, I think so, and I think it's one of the reasons why it's the most commonly performed, plastic surgical procedure. And if it's done appropriately, people are usually very happy. And it's a procedure I do very commonly, and I really enjoy. And it can be on really a wide variety of patients. Some women will get it when they're younger, before kids. Some women will get it after kids, after kind of their breasts have become smaller and they kind of want to get back to where they were. So it's a very, very satisfying procedure, both for me and for patients.
Well, Erin, we certainly thank you so much for sharing your story with us today. And Dr. Bahardi, thank you for joining us as well. Give everybody your information again. If this is something you would like, he does consultations. You can meet up with him. It is Bahardi Plastic Surgery right there on State of Franklin Road in Johnson City. You can check out the website for more information on the different procedures that are available.